thank you all for being here. So I want to pose a question to you, and it's very interesting. All the things we talked about this morning are sort of circling around this question. I'll try not to ruin the podium. So can we preserve the soul of the medical profession in the era of the modern healthcare system? That's the question I want to pose. And I'm going to unpack a little bit what I mean by each of these things. And then I'd be glad, I know I will say some things that might sound a little controversial. I want to be sort of hear your thoughts if I'm askew or if you have a different perspective. I always want to try to get things right. And I'm just delighted and humbled to be here. So thank you all. Now, okay. So as I became acquainted, I've told a couple of you, Far and I have sort of known each other for years, but last year at the medicine and religion meeting, we had a chance to sit down and he talked about the hip sock, and I said to him afterwards something like, I'm all in what you're doing. This is kind of what we talk about at Florida. And so he was kind enough to sort of let us do this. We've had our second chapter meeting, and coming into the new year, we will have 3 coming. But I found this on the website by 2 of our colleagues today, Dr. Shrush and Epperly. The virtue of hope entails 4 core elements: as sound apprehension of the good, a clear apprehension of the barriers to that good, a forward-looking orientation in the face of uncertainty, and an ability to spur direct effort and action to bring about the good. And it occurred to me when I saw that this provides a nice way for me to break down my comments. So I'm going to have 4 sections of what I want to say today. And the first is the sound apprehension of the good. So what is the heart or soul of the profession? I just throw that out there to everybody to think for a minute. And this is, by the way, what I talk about on interview day at the University of Florida. I ask these applicants, they used to be in person, now it's sort of over Zoom. It was more fun in person because I could ask them questions directly, and even though they tried to ignore me, that they couldn't get out of my purveyance. But anyway, so then I said, some of you are biochemists, and these metaphysical concepts may not mean as much to you. If the medical profession was a solar system, what should be the sun? What should orbit around what? And I want to say that there's a historical answer to this question. That actually, we were talking a little bit about the various versions of Hippocratic Oath and how much ones that we use today actually represent or even are descendants of the old Hippocratic Oath. This is the one that we say every year at the University of Florida. And I highlight a couple of sections here. The one that I think is unique to ours is that first one. And I will remember with gratitude and humility those whose illness or injury provided examples from which I learned, and in their honor, I will continue the pursuit of knowledge. That's a pretty noble thing from my point of view. And then, what are the other parts? Conscience, humility, compassion, respect, and impartial care for my patients. So this, or a version of it, goes back 2,400 years. And I could make the argument, if we had more time, it doesn't matter where you go around the world, or historically, if you go to the turn of the century, Avicenna or Ibn Sina, the Muslim theologian, philosopher, polymath physician, or the North African physician, philosopher, Jewish theologian, Maimonides, our own Thomas Sydenham, called the Hippocrates of England, or William Osler, you're going to come down to roughly the same formulation. And what I would want to say is that the historical answer to this question is the heart and soul of the profession has to be the physician-patient relationship. All right, now, I'm going to ask you to sort of accept that. We can debate it later, but let's just accept that and see where that leads us. And Ed Pellegrino has been my hero. I'm such a dolt, I will tell you. He spoke at my medical school graduation, and I had not a clue who he was, and I have no idea what he said. But some 20 years ago, I was asked to serve on a commission at UF to think about the medical profession, and I came across him, and his writings have had an enormous impact on me and hence on many of my colleagues at the University of Florida. And what he says here is the central and irreducible concern of medicine is this patient now with this set of needs arising in this particular illness. It is practical decision taken in the best interest of the person, not in the interest of the knowledge of society or of the physician. Now, if we accept that, we think about medical education. I've been doing this for many, many years. The first time I knew I wanted to be a teacher. I was an intern. I was putting in an IV in a patient, and I had a medical student with me, and I thought, oh, this is actually cool. I can show somebody else how to do this, not just work. And so I knew at that point I was going to be a teacher. But we'll go with the old formulation of science and art. Yeah, I could put many things on here, okay? And when I was an evil interviewer, I would ask medical student applicants. They would say, "So, tell me what you mean by the science and medicine," and they would say, "Well, they could name all this stuff. Everybody can say biochemistry, anatomy, physiology," and I say, "What's the art of medicine?" And I would get some pretty squirmy responses to this, and because it's a little harder to define. What I would want to say is, even in our last talk, the notion of left brain versus right brain things isn't a bad way to parse some of this. I have about 30 things I could throw up there, but I just threw up taking a history, clinical decision making, these things that actually occur at the bedside of a human being. Ethics is always an interesting sort of philosophical idea, but at the end of the day, it has to do with what we do with our real human beings. And when there's boundaries, communication, building trust, all of these things, the larger questions of life that come up, when particularly as I am as an oncologist. Now, I'm curious, I show this guy's picture a lot. How many of you have read anything by Walker Percy? I am glad to hear it. That's a fair number of you. I've been such a Walker Percy enthusiast that my wife last year, almost exactly at this time of year, took me to St. Francisville, Louisiana for the annual Walker Percy conference. If you didn't know there was such a thing, there is such a thing. And it was one of the great experiences of my life. And I'd like to tell you a little about him if you don't mind. He had a very tragic childhood. His father took his own life when he was about 13, moved in with another family member, and his mother died in a single-car accident along with his sister. Some suspect that was suicide. He was then adopted by his Uncle Will and grew up in Mississippi and went on to UNC and then to Columbia to become a physician. While he was in Columbia, and as he was about ready to go do a psychiatry residency, he developed tuberculosis. This is in the mid-40s. He was consigned to a TB sanatorium in northern New York, and there he began to write. And he actually never practiced medicine. For only a few weeks, he did a little family practice, but he became a writer. And it took 20 years for him to develop his skills as a writer, but in 1962, he published a book called The Moviegoer that won the National Book Award. And he overnight became a bit of a celebrity and has multiple, he has this wonderful perspective as a novelist and as a physician. And that has helped me sort of shape my own understanding of what we mean by the art of medicine. So what Percy says in some of his essays as he thinks about this, he says that science is this project of showing how things are the same. Now, I will admit, the first time I read that, I thought, what are you talking about? Then he sort of unpacks, and you go, okay, I'm a lymphoma doctor. Okay, we have things called diffuse large B-cell lymphoma. We then have realized that there's germinal center subtype and activated B-cell subtype. And the reason we separate them is because the natural history is different. And if you're going to do clinical trials, you want to have similarities in the people that you are caring for. So science is really about groups of things. But he points out that the novel, historically, is a somewhat uniquely Western art form and tells the story of how one person is unique in the world. If you think about any novel you've read, there's truth to this, and that's true of all of his novels. In fact, all of his novels, they're kind of autobiographical. You can see him as a person in the main characters as he struggled with his thoughts about the world. So both are diagnostic, okay? Science and medicine, we've talked about these sort of laissez-faire, what I've called laissez-faire scientism or materialism that just sticks to everything we do, okay? And it's there. But what he would say, I would say the scientific method is the best way to make sense from an epistemological point of view of the material world. But if you start taking the scientific method and try to turn that to metaphysical questions, to me, that makes about as much sense as asking whether I can do an echocardiogram to tell if John has a kind heart. There's a little sleight of hand linguistically there, but that's sort of what I think is going on and all of us are struggling with. So, summary, basic science clinical trials tell us about groups of patients. The art of medicine tells us how one patient is a unique individual. And I would make this case, if I don't know enough about the people I'm taking care of to know why what I'm doing for them matters in their life, I may be a great technician, but I don't think I'm a physician. Okay, so the soul of profession, art and science, they come together in the physician-patient relationship. Is there a clock that can tell me how long I have, Michael? When am I supposed to be done?
Yeah, very good.
I have 5 minutes? Okay, that was, 35. Okay, good. I can always go, the end. That's good. All right, so now think about this for a minute. We should be teachers, all of us in one sense or another, and I've spent most of my career doing this. How are you going to do that in medical education? And you might think of it this way. I love the old Frank and Ernest cartoons. What exactly is a medical school equivalency diploma? Maybe if we teach skills and knowledge, but not the other stuff, we're doing basically that. We're doing a medical equivalency. We talked a lot about formation. How many of you are familiar with the work of the Cruises on professional identity formation? They're a pair of educational psychologists from Canada. I think they retired in the last couple of years. They were in their 80s the last time. Brilliant stuff, but it actually borrows language from the spiritual world. I'm not even sure that anyone realizes this, okay, but they certainly borrow this language. And the basic idea, and to my medical student colleagues, I want to apologize to you. I'm not suggesting that over here you are somehow simian, okay, over on the left side. But it's sort of the idea that when you're learning to be a doctor, you're not just learning knowledge and skills. You are learning a way of being, a way of living. And that goes on. And then they're telling, certainly in my experience, this goes on until you're early to mid-career in your sort of final job. And I would make the case that even at 66, I'm still developing my own professional identity. And I hope I'm getting better at it. It's not just learning stuff. It's learning how to be a good physician. So this actually, I think, takes a little pressure off from my young colleagues. We're not going to spit you out 4 years of medical school and expect you to know all of this, but to understand this is a process. And it might be worthwhile, I'll just say this part, and other people, it might be worth it there to have some educational stuff that's sort of from our society that looks at this process, because there are a lot of things that are involved. I just thought of that standing here. It may be a bad idea, and I'll throw it up anyway. So in the idea of professional identity formation, each student adopts the values of the profession or the soul of the profession. I have to say, I just love the idea of becoming what you ought to become, what you were intended for as the soul. And so thank you, Dr. Postel, for sort of giving that, because we're asking the question, can medicine be what it ought to be, what its natural thing is? And I think it can. Then you have another question involved. So I'm trying to sort of think about what a doctor is from multiple points of view, and I know you all have experienced this. Somewhere around 5 to 8 years ago, more and more students kept coming to medical school and saying things like, ooh, I need safe space, don't use those words, I can't tolerate this. And it was driving us nuts. Seriously, I mean, as the teachers, we were just going nuts. And they had learned this behavior in their undergraduate education. Most of them obviously don't come from the kind of education that many of you had. So we kind of came together and came up with a metaphor. So I'll ask them, what's medicine like? And when I've done this over the years, students have said to me, well, medicine's kind of like undergrad, only harder.
Good.
You know, well, in the first 2 years, now it feels that way. One of our students put it this way. I like to scare them on interview day a little bit. I say, yeah, 2 weeks in medical school is like a semester in college. They're like, you're kidding, right? No, I'm not. That's when you get up to full speed. Okay? So, what else is it like? Well, for many today, it appears to be some sort of political action committee that they want to be part of, missing the whole point of what we're about. And so with this idea of safe space and misguided stuff, here's what we came up with. That being a physician is like being selected in special forces, but it's for the care of the sick, not in the military, and it is a lifetime calling. We let that sit. I've had many of my colleagues affirm this over the years, and it became much more acute during the COVID crisis, where people literally were risking their lives to save those that they were caring for. And of course, when we talk, there's an obvious implication of this. And I didn't put all the slides in, we don't have time, but medicine is not a safe space. That's what I say to them. In fact, my favorite kid's story is the Chronicles of Narnia, which some of you will know the stories, where the kids go in and Aslan is the king, he's a lion, and they've not met him yet, and they say something to the beavers, well, he's the king, is he good? And they laugh and say, no, he's is he safe? And they say, no, he's a lion, he's not safe, but he's good. And we're trying to make the point to them that get out of your head that there is some way that safety and goodness are tied together. In fact, I think the exact opposite is true. There is nothing genuinely good that is completely safe. So we talk about this, and then I tell them the big thing in my world and in medicine is encountering suffering. And I think the most concise and touching description of this is from Langston Hughes. And I'm just going to read this poem to you if you don't mind. How quiet it is in this sick room, where on the bed a silent woman lies between two lovers, life and death, and all three covered with a sheet of pain. Now, you may be sitting there thinking that I'm not a particularly good recruiter if this is what I'm telling applicants on interview day, okay? But what I say, that I'm not trying to scare you. I want you to hear the truth, and we will do it together, and we will all learn and grow as part of that. So this has kind of been our approach. So that's what I hope is the good, okay? Now let's talk about the barriers to the good. A clear appreciation of those barriers. And man, there's so many ways we could frame this. We've mentioned many of them today. But I'll start with something that every practicing physician knows, charming, the prior authorizations on the left-hand side and the patients with insurance companies on the right-hand side. There is a bureaucracy in medicine, and it has changed. On interview day, I show the painting on the left along with another that has a less flattering view of the profession. Many of you know the Luke Phillips, the doctor, a wonderful story that I won't go into today, but it sort of made its rounds, and probably the most famous picture or rendering of a physician, largely because the artist lost a child and was asked to do a painting of modern realism for the Tate Museum, what became the Tate Museum, and what he chose to do was honor the profession. And so he is the actual, there's a gentleman, there's the father, and the fact that's him, his wife is there praying, and then the child was his daughter. And this is it's a beautiful story honoring the profession. But today's world, how many of you, I go to the doctor too, and I see physicians that are staring at the machine rather than staring at the person. And it just almost has this gravitational pull to our eyes that we've got to think about. Anybody read this book? It's called Charlatan. Okay, so there's one point to this that I love this book. It's disturbing. Okay, I kind of like disturbing things. So it's called Charlatan, and it tells the story of the greatest huckster or quack in the history of medicine. And if that sounds judgmental, I'll let you tell me. Okay, so the story is this is around the time that hormones have been discovered, early 1900s. And Doc Brinkley sort of bought a medical degree. Apparently, you could buy one in Kansas City. He went to a faux medical school, never graduated. And then he started doing these surgeries. And he had a big clinic and farm outside Kansas City where if I was having trouble with my manhood, what we might call erectile dysfunction, I would go to Dr. Brinkley, and he would let me pick whatever goat I wanted out of the backyard. And he would take me to the operating room and transplant the goat's testicles into my scrotum. Scout's honor, not making this up. This is what he did. He made millions doing this, and the story told by Pope Brock really is a remarkable tale of how the guy, the AMA guy, was trying to put him out of business for some 20 years and finally succeeded in doing it. And the only reason I tell that story is to at least make an apology for the presence of the bureaucracies that we have to oversee medical practice. AMA, you can see the numbers there. It goes, it's the oldest. I wasn't aware there's only one that actually has been developed since I was born. Everybody else, for all the students, these all go before us. But the point is, there was this need to make medicine standardized, to bring science into medicine, so that people weren't out there harming patients. Pope Brock actually speculates he may have been the greatest mass murderer of all time, because the three criteria for a charlatan is cash up front, no records, and testimonials. Those are the three things. And no one has any idea how many people he did this to and how many went home and died because they had testicles of the goat implant. Okay, so from all of this, the bureaucratic piece, we have these multiple agencies. We have accreditation agencies. I'm going to show you a little bit about those, government and industry. And one might say that they might be a little out of control. Anybody want to say they thank you? Okay, I've got at least one yes. Found a great quote from Kafka. Okay, so now this is some conversations in the 1950s that were reported by this guy Kafka. He died in about 1930s, like this. And so they asked him, okay, this is when the communist revolution spread, and Marxism was making its way across, and it made its way in the Czech Republic. Okay, how was that? Was that a cool thing? And this is what he said. As the flood spreads wider and wider, the water becomes shallower and dirtier, the revolution evaporates and leaves behind only the slime of a new bureaucracy. The chains of tormented mankind are made out of red tape. Okay, maybe that's overstated, but you get the point. So I would say that I think we have crossed the Rubicon in this regard. And so what happens, what all of us experience every day, is this enormous dark cloud that is hanging over the practice of medicine. I feel it every day. I've had patients harmed because we couldn't get prior authorizations and their drugs weren't being sent, and they actually had aggressive diseases that needed treatment. There's no recourse as far as I can tell, other than me getting in trouble, which I did, because I started yelling at everybody. See, I wish I was kidding on that too. I did. Okay, so we have the accreditation side. And I just made a few of them here. We have JACO for the hospital side, ACGME for the residencies, LCME, AAMC. We have to all now be certified for privacy compliance. I just got my little note that I had to redo my privacy training. It's everywhere, and it continues to expand. And over on the left upper side, you see these are all pathology kinds of things that are always, somebody's always there looking over your shoulder saying, you got to do it. You got to do it this way. Then we have the governments at multiple levels. Right now, the trustees of the University of Florida are trying to govern me into doing admissions a particular way. And I don't find that very helpful, to be honest with you. Of course, we have CMS. We have the state of Florida that has its own rules. Each of you has your own. EPIC, many of you younger folks may not realize, was the result of a government mandate related to compensation. Your compensation would drop 10% if you did not adopt the online medical record. I think that was the number. You have the FDA, HHS, depending on what you think, is either doing wonderful work or doing terrible things. And then the one that sort of the perennial evil person is industry. We tend to think of insurance companies. We had at our second HETSOC meeting, and we talked about the notion of justice, and I had to acknowledge that I did have to recognize that insurance companies do have some due in justice. And that was hard for me to do, but I did. But there's industry everywhere. We have insurance. We have, of course, the medical device companies and the evil pharmaceutical companies, which in some literatures they're actually hyphenated because it's one word, evil pharmaceutical. I would say that's not the truth. There are some that are good and some not so good. And as one who's been involved in those kind of research projects, I think we have to be circumspect about it. And many physicians get involved and find their way into fraud. So there's plenty of reasons why the industrial side, and then my UF Health loves to call itself, I forget what the current motto is, that I think it used to be the science of hope. Now it's human progress has no finish line. That's the one they're throwing out there. They want you to think that as a not-for-profit, that they're not a business. But I tell you, every decision that I see made is fundamentally about money and making sure that they can pay the bills. So what happens? Okay, so these people create a dense and tangled bureaucracy that we have come to call the healthcare system. Okay? They are all powerful, they're getting bigger, and they all answer to each other in a vast matrix that just casts this shadow. And I came up with this acronym a couple months ago, the Medical Accreditation Government Industrial Complex, that is the magic kingdom. And I'm indebted to Richard Gunderman, who telling me, don't call it the magic bureaucracy, Jay. Call it the magic kingdom. You're in Florida. Okay? So welcome to the magic kingdom of medicine. And I'm going to submit to you all that this is not my opinion, but this is a fact of life. Okay? You can disagree with me, but I don't see how, because I get to live in this every day. So the question then comes, well, what do you do now? Well, it has an impact. We're all tired. We all get discouraged. And part of the solution is what we're doing right now. All right, how am I doing? Okay, all right, good. So let's go to the physicians, and young physicians find themselves at this little space. Let me just start by saying, if I'm doing my job right as the Dean of Admissions, I'm going to recruit idealistic young doctors. And they'll say, when I'm, again, doing my little thing, I'll say, every medical school essay says something like, I like science and I want to help people. And then you can see the students go, yeah, that's kind of what I said. Well, good. I don't want you to hurt people, and I'm glad you like science. Okay? If you say, I want to be a jackass doctor who makes a lot of money, it doesn't tend to get you a quick interview at any medical school, particularly not at Florida. Okay? So the question is, what do? They are somewhat naive, not because they're foolish, but because they're inexperienced. And what really happens is all of us walk in with these ideals that we've been talking about today, and this was even mentioned that we can't actually make them work all the time. And this is what Steve Garber calls it. You hit the world with all of its fallen fury, and you start getting tired. You find out that the medical school that I thought was like great is actually broken. The faculty who seem like good people actually are pretty flawed. My patients, my colleagues are flawed, and maybe the most disturbing is we all learn how flawed and broken we are in this process. And what I would say is we come to this Y in the road over and over and over again. And one road is cynicism. We have two words for it. In the medical jargon, it's what? Burnout. Do you know there's an ICD-12 code for burnout now? We have taken what is an existential, universal human experience and medicalized it. That's the more common word that the medical students and residents use. Jaded. Right? Come on, you've heard this word. At least we use it at Florida a lot. So then what's the alternative? Is there an alternative? And I would like to say that there is. The alternative is we need to develop a realistic kind of idealism. And this comes back to sort of what we're doing as a group here today, to think about the world and understand it deeply enough that we have a thick view of human experience that makes sense out of both the beauty of our lives and the brokenness of our lives. And so how do we help our young colleagues do this? I'm going to say there's a couple of ways. Looking forward. A forward orientation in the face of uncertainty. All right, here we go. Anybody know this book? The Fabric of Faith. Well, Steve Garber's been a friend for many, many years. He ran the American Studies program. It was run through the American Association of Christian Colleges for years, and he wrote this book in 1996. I got hold of it sometime around 2000 when we were establishing the study center, and I said to myself, my goodness, this is kind of like an architectural blueprint for how to design an educational program that will help our young folks stay the course. Here's what they did. They looked at all the people that said they believed a certain number of things when they were in college and that these were their priorities. And then 20 years later, they followed them and saw that about half were still living the life, and about half had sort of, don't care anymore. And then he found three factors that were there and common among all the people who were still there, doing the right thing. And it's reasons, mentors, and community. Reasons. We're talking about. We've been talking about them all morning. Understanding the nature of virtue. But we start off, and I'm depicting myself as the evil interviewer again. So as I say, you're interviewing for medical school, and I say, I like science, want to help people. What I ask them is, well, why do you want to help people? And you know what the most common reaction was? Because it makes me feel good. And I say, well, if you're called down to the ER at 3 o'clock in the morning and there's an alcoholic cussing and everybody vomiting on you, is that going to make you feel good to take care of them? And they kind of go, no. So maybe something more substantial than how it makes you feel should be shaping your understanding of, or your vision of what virtue is. And that gets us into a conversation. On real interview days, I would ask this philosophical question. I'm sort of a wannabe philosopher. I suck at it, but I really want to be, okay? I'll ask them, what does it mean to be human? And the students would all just sort of, look at the floor and hope I didn't call on them. But we would eventually get a whole series of answers like the ones that we've been talking about. But then I say to them, I know you think this is an abstract philosophical question. But if you don't know what it is to be human, how can you know what it is to be a healthy human? And they usually pause and they think. And that gets back to the problem that we sort of were talking about a little earlier. I was very glad that my friend mentioned Bertrand Russell. So here's a bunch of answers that we throw out. Homo sapiens, we have superior mental power speech, we have heart, mind, body, and spirit. Are we just complex animals? Actually, that goes back all the way to Desmarais, the French philosopher, physician. I kind of like these philosopher, physician, writer people. But this is not, I even made myself read this little thing from 1749. It doesn't really even, I don't think it would pass as philosophy, but it basically makes the case that we're just complicated machines. And while most people don't know who this guy is, I would argue, just like we've said many times, that mindset still permeates and lingers everywhere we go, in the world in general and in medicine in particular. And then so, yeah, the Bertrand Russell thing of everything that we are, of our loves and hates, is nothing more than the accidental collocation of atoms, doesn't actually sound very helpful when you're talking to somebody just suffering. And we were talking a little earlier that at the bedside of a patient, you can actually ask a question. That doesn't make sense out of what I'm experiencing here and what this patient is. But that understanding of that reductionist understanding is just too thin, and it doesn't make sense of my experience. In fact, we're in this weird place, and we may be one of the first cultures ever that doesn't have a unified agreement of what being human is. And Percy puts it this way in his last book, Lost in the Cosmos: you live in a deranged age, more deranged than usual, because in spite of great scientific and technological advances, man has not the faintest idea who he is or what he's doing. And that kind of confusion then leads everybody, well, we can't understand or agree on all this metaphysical stuff, but we do know science is good. And so what then happens, you have the technology proliferation. I am very thankful for it. My wife had a cord compression syndrome last year where the cord almost lost all function, had an emergent, beautiful procedure done by a very competent neurosurgeon, and she just came back 2 weeks ago from her Camino de Santiago walk where she was gone for 2 weeks. That's a beautiful thing for which I am thankful. So the technology matters. And what you then end up with, we just lose it. All right, we're good. Okay, well, thank you. That's nice to know. So what I would say is that what you then end up with is money, power, and science. And that's where our systems go. Moreover, because all the technology generates revenue for our health systems, they are ready to support it, and all the other stuff just gets crowded out. We have our transhumanists. We have all sorts of depictions of the modern world who may not know the roots of their beliefs, but they're still there nonetheless. And we end up with the healthcare delivery machine that you feel like. This system, whether it's designed or not, doesn't matter. It actually tries to convert us from having relationships with patients to having transactions with patients where we become nothing more than cogs in the healthcare machine. And there is a word for that. What do we use? Provider. So every time somebody says you're a provider, they're saying you're a cog. I have nurses who work with me. I have PAs. I have physicians. I have people who are healthcare professionals who care about them. And this power is there all the time trying to convert us into cogs. And then you might ask the simple question, what does that do for our humanity? A few things up here, okay, that make us human. If we had the time, I could show you that the healthcare factory undermines every single one of these particular things that make us genuinely human. The reason I highlighted language is that is Walker Percy's view of what is the fundamental thing that makes us different as human beings, is the acquisition of language. And he writes about it beautifully. And after a crazy guy named Charles Saunders Peirce from the late 1800s. So that's the kind of thing that I think are conversations we can have that are about the reasons we do, as well as virtues. We have mentors. John Henry Newman put it this way: an academical system without the personal influence of teachers upon pupils is an Arctic winter. It will create an icebound, petrified, cast-iron university and nothing else. He was talking about undergraduate ed. Imagine how true this is when we're actually caring for other human beings. We could talk about this a long time. Here's one paper from Penn. They asked a bunch of Penn medical residents, what are you looking for? Who are the people that are the humanistic physicians? Which is their word for caring docs who care about it. And all of these things show up. These are the kinds of things that you will find in the Venn diagram overlapping with what we're talking about in this society. The need for the humility, curiosity, standards of behavior, the importance of humanism, modeling humanism. These are all things that are important for us, and there's tons written about this, and I would commend it to you as part of our ongoing conversation. And then finally, community. All right, we got about 10 minutes. Good. Community. How many of you have read Wendell Berry? Good. A larger percentage of you. I would say that this gentleman, who actually is, for those of you who don't know, turned 90 this year, a 90-year-old farmer in Kentucky, who in 1968 wrote this thing right here I'm going to read to you about what community. Stay with me. I know it's after lunch and we're all tired. Okay. A community is the mental and spiritual condition of knowing that the place is shared. Right now we're sharing this place. At each of your schools, you share the place. Okay. And that the people that share the place define and limit the possibilities of each other's lives. I have to take into account what is going to happen to Carrie. I just can't do things on my own. I have to think about the other people in my community. It's the concern we have for each other, the love, the trust, and the freedom that we come and go. You cannot force people into a community. It has to be a decision to stand forward. And what he has done from the rest of his life, Wendell Berry, is writes fiction and essays, but mostly fiction about what community looks like in this little town he invented called Port William. It's astounding. For those of you who are looking for a place to start for him, Fidelity is a collection of 5 stories. The first one, Fidelity, is actually a medical story. And he even alludes to the Magic Kingdom, not by that name, but you'll see what I mean when you read. How do you start a community? How do you make a community work? This is Dietrich Bonhoeffer, many of you know, part of the resistance to Nazi Germany. People who love their dream of community will destroy it. The people who love those around them will create community. Could it really be that simple? Where we find ourselves, love the people around us. Yes, I think it is. And community then emerges. Or the Reverend Dr. King put it this way: our goal is to create the beloved community, and this will require a qualitative change in our souls as well as a quantitative change in our lives. And so all communities versus tribes actually have a purpose above their identity. And so what is it that we have? This has been, when I was the program director for hematology oncology, this is what we did. We've been doing this now for 14 years at UF. We take care of one another so that we can learn, discover, and take care of our patients. This way of sort of other-centeredness then leads to a way of being so that when you do step into the hospital, you're there ready. You've learned how to think this way. This is that to which we aspire. So finally, hope in difficult times, to spur direct effort and action to bring about the good. Shockingly, I think the Hippocratic Society provides all of these things. When I was hearing Barr talk about it at the Religion and Myth, I said, yep, meets all the criteria. We've got reasons. We're going to talk about virtue education. We're going to fill that hole in the minds and hearts of many of our young colleagues who've never been taught that there's such a thing as virtue. Okay? We're going to have mentors both here and in our homes to show them what it looks like. And then there's a community, national and locally. So I was like, this is awesome. So thanks for inviting me. So what is it I'm trying to become? This is another 50 years ago. Ed Pellegrino wrote this, and I'm just going to read it. In the ideal physician, the profession is graced by a complete human in whom science and art, profession and life, morality and competence are inseparably united. This is the ideal towards which each of the engagements between the idea of human and medicine must ultimately tend. And every time I read that, I feel obligated to say, I wish it describes me better than it does. But I hope it describes me better than it did 5 years ago and 5 years before that. Chesterton sort of characterized modern people as dumbing down virtue to look like us. I am so thankful that you all, and then calling it progress. Okay, I'm so glad that we've decided, no, virtue is here, and I'll never get there, but I will get closer over time if we do it together. This is our first meeting. It's in my living room. I think I have 5 minutes left to talk about some very personal things with you. And I hope you all don't mind I'm going to do this, okay? One of the things about suffering that is interesting, and this is going back to Thomas Sydenham, said as we are dealing with people who are suffering, we, as a physician, we need to be gentle, caring, because we are no different than them, and we will be fellow sufferers with them. I would make the argument that every one of us is a member of the community of suffering. We can either choose to ignore that, pretend it isn't so, or embrace it and live this way. So, we're trying to help our young colleagues build a life in medicine, and I'm going to talk a little bit about mine. It's not about me. We are, if your experience is anything like mine, we are hardwired to make everything about us. Every time I turn around, is this helping me? What's this doing for me? It is part of the human condition. And I literally say to myself probably 5 to 10 times a day, even though I'm 66 years old, and I should have figured this out by now, it's not about me when I find myself getting frustrated. And part of what I think the cultivation of the virtues does, and all we've been saying this morning, is it provides a discipline by which we escape the prison of the self. And that leads me to this, actually is the topic for one of our essays for UF College of Medicine last year and this year, to discuss the paradox of the self. The more I worry about myself and think about myself, the more miserable, anxious, unhappy I become. But the more I can live with a kind of graceful self-forgetfulness, the more I can serve others with joy and fulfillment. That's something that I'd love everybody to just be thinking about. It doesn't mean we don't take care of ourselves, and that's not what I'm talking about. But we become sort of caught up in the community of those who are around us to love and care for them, and then have the humility to allow them to care for us, which I've had to learn very personally. One of the things about this that mentors at UF seem to be able to do that I appreciate is this idea of vulnerability. Talking about my own failures. In the first year class, in what's called CABCO, which is Cancer Biology and Clinical Oncology, I do the last lecture for that, and I talk about the effect of medicine on me. And I tell them quite plainly how in 2002, I got to the point that I was so depressed that I was actually contemplating suicide. And I am so grateful to my community of faith, who I was able to confess that to and get the help I need. And when we asked what are some examples of great physicians, one of them is my psychiatrist who called me into her office. The next day I just said, look, I broke down and started sobbing in front of a patient who was a close friend. Okay, that's not good. Yeah, I knew that wasn't right. And so I called her, and so I went over to see Jessup and sat in her office, and she just said, Jay, what is it about life that makes it so not worth living? And what came right out of my mouth without thinking was, all I do is disappoint everybody. And even when that came out, I knew that wasn't intellectually true, but the neural networks were all twisted and broken, and it twisted the way that I perceived the world. And I'm very thankful that I have the chance to do that and to tell the students, and you probably won't be surprised, there's a stream of young people that come to my office after I do that talk because they want to talk about it. Oh, you actually survived and you seem to be okay as a doc, okay? Yeah, so stories, it occurs to me that we talk a lot about right brain function using our left brains and trying to describe it and analyze it, and when in fact, the right brain actually has its own means of communication, and they are stories, narratives, among other things, poetry, as I read that poem. Walker Percy said this, I love it. Fiction doesn't tell us something we don't know. It tells us something we know but don't know that we know. We have this intuitive sense that life is more important than simply reductionist understandings. And by a story, we can actually draw that out and give them a way to make sense out of it. And then the heart is in our hands and we can talk about it. Right? Not just fiction, but our own stories. We need to engage the soul. And if you think about it, any story that I tell, there's an understanding of life, there are mentors, and there's a community involved. And so the stories that we tell have embedded in them these things. They do penetrate the soul. Anybody seen The Most Reluctant Convert, where Max McLean plays C.S. Lewis? If you get a chance to see it, you got to see it. It's great. He's great at it. Well, he talked at the Christian Studies Center to us afterwards, and he said one of the things he's trying to do is I make them laugh, and then I pour the truth in while their mouths are open. Humor is a great way to sort of draw down the defenses that people throw up. And I think it's wonderful. For the last 3 minutes, I'm going to tell you stories of my family and try to show what I think community actually looks like. Let me give you some context. So that's me standing with my mother and father. My dad was a World War II pilot and a Marine pilot and a NASA engineer. We grew up in Virginia. My mom was 10 years younger. And I'll love telling the story when they first met. So did you see, anybody see the movie Hidden Figures? Okay, my mom was a computer working at NASA, okay? And so my dad was a NASA engineer, and one day in August, she needed a ride to work, and everybody kept trying to get them together. This is 1951. And so my dad drives up, and he had this basic thing. Here's the two things. I can't stand it when women cuss, and I hate smoking. The first thing my mother did when she got in the car, damn, it's hot, and she pulled out a cigarette. It's absolutely true. Less than a year later, they were married. So, and they were wonderful parents, and there they are at their 60th anniversary. But on June 13, 2013, my mother passed away. It's the same day that Ed Pellegrino died. Interesting. And that picture I took of her is at the foot of the bed, my father to the right praying, my mother there with metastatic breast cancer. And she was an amazing lady. She was the extrovert of the family. And if you went in to see her and wanted to talk to her and you looked at your phone, a medical oncologist did this when she was diagnosed. She goes, "You're done. Get out of here. I don't want you. Your phone's more important than me. I don't want you as my doctor." She could be a handful. And so anyway, so she had all these doctors taking care of her. And it's actually hard for me to tell. And my sisters, who both live in Virginia, I would go up there when I needed to and came back home. My sisters would tell me, "Jay, you'll love this." The surgical oncologist came in and started talking to Mom, and he was listening to her. He actually sat down to talk to her and heard her story. And my mother apparently said, "Well, my son is a professor at a medical school, and he would like your bedside manner." And the surgeon asked, "Well, where?" And she goes, "He's at the," and she never forgave me for moving to Florida from Virginia. "He's at the University of Florida." And then the surgeon said, "Is your son Jay Lynch?" He was one of my professors. Jason Wilson found his way by either reductionist chance or by providence and grace to my mother's bedside. And after she passed away, he came down through, we chatted and caught up. And I said, "Yeah, I really appreciate you looking out for my mom. I know she could be a handful." And he said, "Yeah, you won't be surprised, Jay, that she was always my last patient of the day." But the story doesn't stop there. Then within a year and a half, my father was becoming ill. He had heart failure, kidney failure, metastatic prostate cancer. And he got to the point when he was 90, just short of his 92nd birthday, he said to me, "Son, I'm ready to go join your mom." So we had hospice on board. Am I out of time, Michael? Okay. Give me one more minute. I think we'll be at 2 more. And so it was time for him I was there with him, and he actually sort of slipped into a coma. His pupils fixed and dilated, but he had a pacemaker and needed to be turned off. So it's going to be a while before they could do that. They had to have a palliative care doctor come, actually certify this. And so I was back home, and I get a call, and my sister says, "Jay, the doctor wants to talk to you." And I hear a voice on the other end saying, Dr. Lynch, I don't know if you remember me, but I'm Deborah Morris, and my husband and I went to Florida, and I'm so thankful that I can be here to take care of your dad this time. I can't put into words what comfort it was to know that one of my own young colleagues was there doing this work. But it's even with me. How many times do you guys see high PSAs? See it all the time, right? Well, we think of data as abstracted, but that's not abstract. That's my PSA. Okay? 2 years ago. Prostate cancer. Yes, I wasn't waving a flag saying I'd like to be the oncologist wants to get cancer, okay? But I sat in my own waiting room, waiting to see one of my colleagues, had radiation and hormone therapy. And so now I'm in remission, doing well. I'm very thankful for all of that. But yeah, God is good, and I'm very grateful. I'm really sad because what I was going to show you is that's a video of my 18-month-old grandson being a drummer, but it doesn't project here. And so he is the cutest young man in the world. It's actually, and that's by an objective criteria. And that's going to go. All right. I'm going to leave you with a quote. All right. Every time I or a member of my family becomes ill, it will make me a better doctor if I allow it to. But each of us has to step towards that and allow that to change us and remind us that we're all part of the community of suffering and let people be who we are. And with that, I always can say more, so I will stop. Thanks, Michael.
Thank you, Eric. Very beautiful. So now we have a break. You'll be back here with 4 great presentations.
Thanks.
Go back.
Thank you, buddy. Appreciate that. All right.